Good evening, everyone. Firstly, I would like to welcome all of you to this 11th Journal Club session. So let's begin today's session. So firstly, good evening, everyone. Again, welcome to 11th Pan-India Journal Club session. So today's Journal Club session is on the topic of ameliorating chronic kidney disease using a whole food plant-based diet. And the flow of presentation is going to be the panel introduction. First will be done by Srinidhi. Introduction and conclusion will be done by me, Dr. Sindhura. Carbohydrates and fiber will be done by Dr. Preetham. Proteins and lipids will be done by Dr. Melinda. Inflammation part by Shivani, acidity and alkalinity by Srinidhi, electrolyte balance by Dr. Sandhya, and drawbacks by Josna. So this is today's flow of presentation. Am I audible for everyone, right?
Well, ma'am, audible. I think there's an
Okay.
issue with her.
Yeah, with her audio settings, right?
Yes.
Okay, so the panel action will be done by Srinidhi. Srinidhi, can you please take over, please?
Thank you, ma'am. A very good evening, everyone. So, Physicians Association for Nutrition is an international organization of healthcare professionals on a mission to make nutrition a central pillar of healthcare. We believe that evidence-based nutrition is a key to preventing and treating chronic diseases, promoting a healthy planet, and creating a more sustainable food system. We facilitate the seamless integration of evidence-based nutrition into mainstream healthcare. PAN advocates for policies and strategies that create a healthy and sustainable food system accessible to all. It also fosters international collaboration among medical professionals. We believe by sharing knowledge and best practices, we can create a global movement towards nutrition centered healthcare. By focusing on these core activities, PAN aims to create public awareness and empower individuals to take charge of their own health through evidence based nutrition. Next slide, ma'am. So, this is our esteemed leadership panel, Dr. Alan, Dr. Nicholas, and we are fortunate to have Dr. Rajina Shaheen, ma'am, our medical director. Her tireless efforts and strategic vision have been instrumental in advancing PAN India's mission. Next slide, ma'am. PAN team has a very strong structure built on the contributions of medical professionals, doctors, nutritionists, and other healthcare professionals collaborate as program managers, ambassadors, and volunteers, forming the backbone of our organization. We also actively engage with our international team who are actively involved at various capacities. So, are you a doctor, a medical student, or a healthcare professional passionate about nutrition? Team Pan India welcomes you. We encourage you to join us as ambassadors, volunteers, or in any capacity that aligns with your expertise. Together, we can make a significant impact on integrating evidence based nutrition into mainstream healthcare across India. So, without any further ado, let's dive deeper into today's insightful study titled Ameliorating Chronic Kidney Disease Using a Whole Food Plant Based Diet. I request Dr. Sindhura ma'am to take the discussion forward.
Thank you so much, Srinidhi. So coming to the introduction part of today's study, so a basic regular introduction, as we all know what our kidneys are. So they are two bean-shaped organs, so which has a lot of functions like regulating our blood pressure, activates a vitamin D production, and the production of the red blood cells, which filters about 120 to 150 quarts of blood daily and removes the waste products from the body and balances the body's fluids. And if we look at more than 1 in 10 Americans have chronic kidney disease, if we talk about the numbers. And even the prevalence rate of CKD in India is almost about 13 to 70% again. And if we look at heart disease is one of the #1 cause of death for people with chronic kidney disease, and diabetes and hypertension are the two leading causes of the kidney disease as well. So, early detection can help prevent the progression of kidney diseases. People at high risk for kidney disease should receive frequent annual screenings, and diet and exercise can improve the overall well-being and can help manage the conditions. So if you look at the chronic kidney disease, it's a progressive and irreversible syndrome of reduction in renal capacity, eventually leading to death when enough nephrons have been damaged. And CKD is the chronic kidney disease emerged as one of the leading causes of mortality with its increasing death rate. And the heavy burden is mostly seen in the low and middle income countries. The CKD is one of the top 10 leading causes of premature mortality in the US, and its incidence is increasing, and even the prevalence of CKD in India is also quite increasing. And a staggering 96% of the individuals with mild to moderate decrease in kidney function is seen, and 48% of individuals with severely decreased kidney function are going undiagnosed. And CKD is often accompanied by various comorbidities that puts the individuals at further increased risk of mortality, making it a costly and also a burdensome public health issue. Beyond the medical burden, it also reduces the quality of life for both CKD patients and their loved ones. If you look at the epidemiology of the chronic kidney disease, a 2022 update from the International Society of Nephrology, so we can see approximately 1 in 10 individuals are affected, and this particular CKD is more prevalent in individuals with diabetes mellitus, hypertension, more prevalent in women and in elderly. And also, if you look at the death rate from 2013 to 2040, if you can see, it's almost increasing. In 2013, it has ranked in the 19th place, and by 2017, it moved to 12th place, and by 2040, it is estimated that it can be a 5th cause of mortality. And as we have already seen, it has been contributing, or it's been the largest burden in the low and middle income countries. So chronic kidney disease occurs frequently and has devastating consequences, which should prompt the major efforts to develop preventative and therapeutic measures that are effective. And the aim of these measures should aim at lowering the incidence as well as the slowing down its progression as well. So if you look at the CDC stats, more than 1 in 7 US adults are affected with CKD. And if we look at the adults with diabetes and high blood pressure, 1 in 3 adults with diabetes may have chronic kidney disease, and 1 in 5 adults with high blood pressure may have chronic kidney disease. And if you look at the global prevalence of chronic kidney disease among adults aged 65 plus, you can see 1 in 5 men can have CKD, 1 in 4 women can have CKD. And if you look at the adults aged more than 75, 2 in 5 men can have CKD and 3 in 5 women can have CKD. So as you all know, these are the various stages of the chronic kidney disease, so which will be based upon the glomerular filtration rate. So if the glomerular filtration rate is more than or equal to 90, we can say it's normal. Stage 2, which is mildly decreased glomerular filtration rate, where the GFR is 60 to 89. And if it is 45 to 59, it is stage 3A. And 30 to 44, it is stage 3B. And if the GFR is 15 to 29, we can say it's stage 4 CKD, where it's severely decreased the kidney filtration. And if it is less than 15, if the GFR is less than 15, we can say stage 5 and kidney failure. So these are the stages of chronic kidney disease by the glomerular filtration rate category. And if you look at some of the risk factors of the chronic diseases, which can be like your high blood pressure, diabetes, heart disease, obesity, smoking, the family history of kidney disease, and all these can put an individual at a higher risk of developing kidney diseases. And if you look at some of the symptoms of the chronic kidney diseases like dry and itchy skin, tiredness or weakness, bubbly or foamy urine, swelling of hands, feet and ankles, puffy eyes, trouble in sleeping, loss of appetite, muscle cramps, and need to pee more often are some of the common symptoms that can be seen in people with CKD. So a majority of CKD patients have hypertension, and between 20 and 40% of individuals with type 2 diabetes will go on to develop CKD. So the risk of all-cause mortality, including mortality due to CVD, is higher in individuals with CKD, making this a topic of priority in the effort to mitigate the preventable death and diseases. If you look at the current treatment for individuals with CKD, it can be either the blood pressure medications like AC inhibitors, cholesterol medications like statins, erythropoietin supplements, diuretics, phosphate or potassium binding drugs, calcium and vitamin D supplements, and a low protein renal diet. So typically, CKD patients will be placed on a renal diet, which focuses on reducing individual macro and micronutrient food items such as protein, potassium, phosphorus, and sodium has to be taken care of, which can slow down the CKD progression and also slows down the symptoms of the disease. However, the renal diet has not proven effective in preventing the complications, the comorbidities that can accompany the chronic kidney disease. So individuals which are prescribed renal diets, they often reduce their intake of certain healthier foods like leafy greens, strawberries, bananas, oranges in order to prevent the overconsumption of a specific macronutrients like potassium. Rather than focusing on the macronutrient and micronutrient content of individual food items through restriction medication, there is a huge need to focus on a dietary pattern that can improve the overall health in the CKD patients, like choosing a well-balanced diet of fruits, vegetables, whole grains, legumes, and lean protein can help. So a China study conducted by T. Colin Campbell and team was identified as the most comprehensive study of nutrition conducted till date, and it reported a pattern of eating that reduces CVD and type 2 diabetes risk factors and comorbidities of CKD through consuming a whole food plant-based diet. This particular dietary pattern, which is similar to a vegan diet, it focuses on plant-based products, eliminating or minimizing all animal products, including your meat, fish, eggs, and dairy. And it derives most of its caloric energy from whole and unprocessed foods. While the macronutrient consumption can vary in this dietary pattern, is typically composed of 7 to 15% fat, 75 to 80% carbs, and 10 to 15% protein. So if you can look here, this is a beautiful picture of whole food plant-based diet pyramid, where this WFPB diet excludes all the highly processed refined foods, isolated vegetable oils, sugars, and bleached flours. So we can say WFPB diet is much more healthier option than the vegan diet, because vegan diet does not restrict you in consuming processed and refined plant-based foods. But in WFPB diet, it is going to exclude all the highly processed and refined foods. And the main focus is going to be on fiber-filled foods, which are naturally rich in vitamins, minerals, and are low in caloric density as well. So the WFPB diet includes majorly of fruits, vegetables, grains, whole grains, legumes, leafy greens, and fats and oils. So evidence for the benefit of a whole food plant-based diet has been widely documented, and it is a novel, and it can be considered like a novel and a cost-effective intervention for patients with chronic kidney disease and for its comorbidities associated with the chronic kidney disease. While a majority of individuals diagnosed with CKD undergo pharmaceutical treatments, many of the prescribed drugs relating to these disease and its comorbidities can have certain negative health consequences and do not address the behavioral and environmental problems associated with CKD. So therefore, it is important for us to establish an intervention that decreases the pill burden associated with CKD, as well as alleviates the comorbidities of CKD, which serves as a cost-effective method for preventing end-stage renal disease. So the goal of this review is to summarize the current evidence for a whole food plant-based dietary intervention and give an overview of how comorbid conditions of CKD and the respective mortality rates can be ameliorated by implementing a whole food plant-based diet. So by describing the components of whole food plant-based diet, this review will report unequivocal evidence for the utility of a WFPB diet in the prevention and treatment of CKD. So if you look at the whole food plant-based diet, which is rich in fiber, can help in increased production of short-chain fatty acids and bile excretion. It can help in achieving better glycemic control, better insulin sensitivity, reduction in serum cholesterol, serum urea, and reduction in creatinine. And the whole food plant-based diet is low on fat content, specifically the fat content, which helps in minimizing the dietary and the serum cholesterol, reduction in sad fats, and this whole food plant-based diet, when it is properly managed, it's properly planned, we can get an adequate amount of protein, and this can help in by consuming the whole food plant-based like protein-rich foods, we can not only get the protein, but we can also get the phytonutrient, antioxidants. It's going to reduce the proteolytic catabolism. Most importantly, the uremic toxicity and the inflammation can be reduced by including plant-based proteins, and there is going to be reduction in the phosphorus values as well. So overall, we can say by including whole food plant-based diet, it can help in reduction in blood pressure, CVD, inflammation, and mortality. So today's study is a literature review which talks about ameliorating chronic kidney disease using a whole food plant-based diet, which was published online in April 2020, and the authors are Kathleen E. Adair and Rodney G. Bowden. So this completes the introduction part, and the carbohydrates will be continued by my colleague, Dr. Preetham. Dr. Preetham, you can continue, please.
Hello. Yes. Yes, Dr. Sindhura, thank you. Thank you. Just briefing about how what is chronic kidney disease and how this exactly that whole food plant-based. Superficially explain that how this whole food plant-based diet is helpful to overcome this chronic kidney disease and its complications. So further in our further slides, let us see what the whole food plant-based each component, okay, the how it is beneficial in reducing this chronic kidney disease as well as its complications. So we all know that the diet plays a crucial role in management of not only the overall health as well, it also helps in that crucial role in managing this chronic kidney disease as well. So in this, we should take that, we should look into that, or we need to understand how this carbohydrate intake actually impact on our insulin metabolism. And also the overall health is also essential. Why? Because we already know that this chronic kidney disease is already associated with a significant alteration in this insulin metabolism, right? So that's why it is essential to know how the carbohydrate look into that management in the chronic kidney disease. And it also established that approximately 44% of the chronic kidney disease patients, they develop the condition mainly due to the pre-existing diabetes. Moreover, the altered, as I said, the altered carbohydrate metabolism in this chronic kidney disease, it contributes to the accumulation of AGEs, that is advanced glycation end products, which is known, we know that it is show that it known to be very detrimental to our various organs and tissues. So therefore, we need to balance the intake of the carbohydrate in the patients, chronic kidney disease patients, mainly to manage the insulin metabolism and also to prevent the metabolic complications and to promote the overall health. So if we come to the carbohydrate, we know that the carbohydrate is the primary source, energy source, right? So in this, at least we need to take 60% of the total energy, it should come from the carbohydrate. If the person is a diabetic, or if the person is an obese or the hypertension, again, we need to prioritize the whole food grains, right? If we need to look into the low glycemic carbohydrates, that includes the whole grains, vegetables, legumes, that is which digest slowly and gradually it increases the blood sugar levels. And also portion size also important. So because the amount of the carbohydrate will always depend on your weight and the activity level. And we always need to focus on we need to take the complex carbohydrates over the simple sugars. Why? Because these complex carbohydrate, of course, they provide the carbohydrate, along with that they have the package of the fiber and the essential nutrients. And sometimes what happens, again, while choosing the whole food plant-based, we need to look into the content of the potassium as well as the phosphorus in the chronic kidney disease patients. And while some of the content can be reduced by soaking and the rinsing of these grains. Yes. So again, we have next slide. Again, we have the fiber. Fiber is also a type of an indigestible carbohydrate which is readily available from the plant-based food. So the dietary fiber which was used, because in the date back long ago only, that is 30 years ago, this dietary fiber they are used as a treatment for the kidney failures. Why? Because it reduces the blood level of nitrogenous waste. And also the Wang 2019 has reported in a Kidney International that every extra 1 gram of fiber intake that was associated with the 11% reduction in the cardiovascular events, which is one of the complications of the chronic kidney disease. So again, dietary fiber intake is around 26 to 29 grams per day. So in this, not only it confers the cardiovascular benefits. Along that medium fiber intake, 27 gram per day, which reduces the serum urea and the creatinine levels, which are the major marker in the abnormal GFR. Right. So in the right side, you can see that how exactly this dietary fiber helps in reducing the chronic kidney disease complications, the cardiovascular, and also the infectious diseases. We can see that the arrow marks which are there, one is which suppresses and the other one is triggers. Right. So first, let us see that how the dietary fiber exactly suppress or decreases the dietary acid load. We know that the dietary acid load is what that the potential acidity or the alkalinity of the food which we usually take. What type of food? What type of a food we take? It is acidic or an alkaline. So on that, it is measured on, or we can calculate through the potential renal acid load. If we get an higher, I think in our further slide also, one of our team member will be explaining in detail how to calculate that potential renal acid load and all. If we get the higher potential renal acid load, we consider it as an acidic. Okay, that is higher in acid load. But the typical Western diet, it is higher in an acid load. And if we come to the whole food plant-based, which is rich in fruits, vegetables, legumes, and all, it shows generally it shows the lower potential renal acid load. So there are many mechanisms that to reduce or suppresses the dietary fiber suppresses this dietary acid load, because it has already has an alkaline producing effect is there, and along with that it is associated with a decrease in serum creatinine again, which helps in the slowdown of this progression of the chronic kidney disease. Next is the dietary fiber. It triggers or increases the saccharolytic fermentation. So that's we know that the high fiber intake that promotes the fermentation, that saccharolytic, it is a bacteria that ferments the carbohydrate. Once the catabolism of the food takes place, so that results in the downstream that increases the beneficial, that is short chain fatty acids, that are butyrate, propionate, acetate. So these products, and again the bile excretion is also one thing. And with these upregulation, it serves to, one is it decreases by all these mechanisms, it decreases the serum cholesterol and also the glucose absorption, while simultaneously it increases the insulin sensitivity. If we come to the proteolytic fermentation, so it's dietary fiber, it suppresses this proteolytic fermentation. So additionally, this fiber, what does it? It decreases the amount of a time of the protein fermentation. Okay, so it decreases that time of the protein fermentation in the intestinal tract. So that results, in turn, it results in a decrease of these bacterial metabolites such as ammonia, that indoles, phenols, okay, and amines, which are derived from the proteolytic catabolism. Again, it contributes, which all these usually it contributes to the uremic toxicity. So that can be, in turn, again it goes into the inflammatory state. So these all can be suppressed by the dietary fiber intake. And the last is, we all know that it is a pack of antioxidant, like fruits, vegetables, and all. They are the antioxidant rich. So again, they act as scavengers. We know that it, what we say, that have a free radical scavenging activity. Again, it suppresses the oxidative stress. So by all these, in turn, it reduces the cardiovascular disease as well the chronic kidney disease complications, right? So we can see that the higher fiber content in which is present in this whole food plant-based diet, it if we take over the normal or in a low protein diets, we can say that the dietary approaches by this whole food plant-based diet is beneficial. So also we need to look into the proteins, potassium, phosphorus, and all. So because those are also the major components which is we need to look into in our while planning the diet in a chronic kidney disease patient. So these proteins and all, the further will be carried by our team member, I think Dr. Melinda, right? Yes, yes. Thank you.
So let's talk about protein. Now, you can see over here, the normal RDA for a healthy individual is around 0.8 grams per kg per day. Now, if you see for the chronic kidney patient, disease patient, the diet intake of protein is low. So the diet for them, like if we talk about low protein diet, it is around 0.6 to 0.8 grams per kg per day. And a very low protein diet can also be given to them, which is around 0.3 to zero point 0.4 grams per kg per day. Now, why do we give them a low protein diet? It is basically, it reduces the uric acid buildup and nephrotoxicity. Since the kidneys are not functioning properly, they are not throwing out the toxic products out. So in order to reduce that, we require to decrease the protein content. Now, according to the modification of diet in renal disease, that is MDRD, they suggest that a low protein diet may provide a small benefit for the individual's renal insufficiency, but it does not ameliorate the progression of the nephropathy in CKD patients. And also, it leads to risk of protein malnutrition. They are anyway throwing out protein, and hence you're also giving a low protein diet. So this makes them more at a risk for protein malnutrition. Next slide, ma'am. Now you can see over here there is already protein basing and a risk of cachexia, which is basing syndrome. It is associated with this population, and a large reduction in consumption of protein may be detrimental to the CKD patient. So when we talk about protein energy wasting, it just means that it's a state of decreased body stores of protein and energy fuel. That is your body protein and fat mass. And when you talk about cachexia, it is defined as a complex metabolic syndrome which is associated with underlying illness and characterized by loss of muscle with or without loss of fat. Now, in this diagram, you can see it summarizes the entire, the pathophysiology behind protein energy wasting in the CKD patient. Now, if you look at the first part, now when you talk about malnutrition, what are the factors which lead to malnutrition? First is the dietary restriction. Then you can see there is anorexia in those patients, and also there is increase in the metabolic rate. Along with that, there is volume overload in the body. There can be also endocrine disorders, vitamin D deficiency, increased parathyroid hormone, insulin resistance, decrease in the growth hormone, and IGF signaling. Now, these are all the functions of your kidney. So because of this, it leads to malnutrition. Along with that, there are comorbid conditions like diabetes mellitus, cardiovascular diseases, infection, aging, acidosis, anemia. All these things lead to uremic toxic buildup in your body. Then there is oxidative stress, increase in the inflammatory cytokines, depression, dialysis treatment related to these factors. Also, catheter infections, peritonitis, and nutrient loss in dialysis. This leads to inflammation. Now, malnutrition, uremic toxins, and inflammation together, it leads to cachexia and protein energy wasting. So this entire becomes a syndrome where all these four things are present. It is called as a syndrome. Now, what are the symptoms of this syndrome? Firstly, there will be increase in the albumin in the urine output. Then there will be trans erythrin, lipid, and decrease in the C-reactive protein. Also, there will be increase in the body weight, maybe because of the fluid retention in the body. There is decrease in the BMI, decreased fat, and decreased muscle. Also, there is a failure of growth, cardiovascular complications, as Dr. Pritam has already mentioned before. Then there is increased mortality, increased hospitalization, and decreased quality of life. So all these all summarizes the protein energy wasting syndrome seen in the CKD patient. Now over here, there is this slide is just showing about the differences between plant-based proteins and animal-based proteins. Oh, I'm so sorry. Am I audible now?
Yes, Melinda, but your voice is little low.
Ma'am, is it still low or?
Still the same.
Now is it
Now
audible,
it's
ma'am?
better. Yeah, it's better.
Okay. So let's talk about the difference between the plant-based proteins and animal-based proteins. Now, in the previous slides, we saw that giving a low-protein diet is beneficial to the people because it decreases the uric acid load on the kidneys and the nephrotoxicity. But over here, what we're talking about plant-based proteins and animal-based proteins, and how though both are proteins, how plant-based proteins are a little beneficial compared to the animal-based proteins. So over here, you can see the first point itself. Plant proteins are typically ingested alongside other plant products such as fiber, phytonutrients, and antioxidants, and they are associated with greater decrease in the blood pressure. Whereas when you see the animal-based proteins, they are typically ingested alongside saturated fats and cholesterol, and this leads to increased blood levels of phosphates, fibroblast growth factor 23,
and this upregulates this actually upregulates in order to compensate for high phosphate levels as nephron function declines. This also promotes proteolytic fermentations. It results in increase in dose and phenols in the intestinal tract, decreases insulin sensitivity, and increases oxidative stress. Now, if you see over here, animal-based protein induces hyperfiltration, while an equivalent amount of plant protein does not induce the same stress. So if you take plant-based proteins and animal-based proteins of the same quantity, plant-based proteins are always superior. Though in CKD patients, we try to lower the amount of proteins, but if you prefer a little bit of plant-based proteins, it might be beneficial to the patient comparatively. Next slide. Yes. Now, coming to lipids. Now, over here, we'll be talking about various studies which talk about cholesterol levels. So, the recommended cholesterol, it's recommended the total energy intake should be 30% and it should come from the fat source. Now, there was a study done in 1955 by Hartroff et al. And it analyzed the post-mortem kidney autopsies, and it confirmed that the nephrotoxicity, which is a theory that glomerulosclerosis develops in the capillary beds of the kidneys, just as atherosclerosis develops in the heart. Secondly, there was another study done by Lin et al., and it was found that animal protein, animal fat, and cholesterol were all associated with increased microalbuminuria and proteinuria, which are the markers of decreased kidney function. In the same study, it also showed that vegetable intake was identified to have slight inverse relationship with microalbuminuria, indicating no association between plant-based protein and decline of kidney functions. Recently, it was also shown that the medicinal efforts to combat this lipid nephrotoxicity, statin drugs were given to lower the cholesterol and slower, decrease the production of, progression of these chronic kidney diseases. So statins were given. Now, there was another study that is by Bernard et al., and it was conducted over a period of 74 weeks in the individuals with type 2 diabetes mellitus. And they found that total cholesterol was decreased by 20.4 milligrams per deciliter on a low-fat vegan diet and 6.8 milligrams per deciliter on a diet following the ADA guidelines. Also, LDL cholesterol was reduced in both the vegan and the ADA conditions. Like in the vegan, it decreased by 13.5 milligrams per deciliter, and in the ADA group, it decreased by 3.4 milligrams per deciliter. But the greater reduction was found in the group that prescribed the vegan diet. A little about omega-3 fatty acids. Now, omega-3 fatty acids are known to reduce inflammation, serum triglycerides, blood pressure, and heart rate, while increasing serum HDL cholesterol. Plant-derived omega-3 fatty acids, known as alpha-linoleic acid, are commonly found in vegetable oils as well as in foods such as flaxseeds, chia seeds, olives, walnuts, broccoli, Brussels sprouts, and soya beans. Now, over here, you can see the ingestion of around 1.5 to 3 grams per day of alpha-linoleic acid has shown utility in preventing the development of cardiovascular disease in patients with CKD. In a meta-analysis of a randomized controlled trial that administered both fish and plant-derived omega-3 fatty acid supplements, it showed that the risk of myocardial infarction and all-cause mortality were both reduced by 20% compared to the control or placebo effect. Also, plant-based omega-3 fatty acids may be beneficial for individuals who progress to ESRD, or that is end-stage renal disease, and require dialysis. There was another study by Mir Fattahi et al., where it showed high doses of flaxseed oil, that is around 6 grams per day, were found to attenuate markers of bone resorption by up to 17% in hemodialysis patients. Although the effects of consuming the foods rich in alpha-linoleic acid may be more modest than those of icosapentaenoic acid, there is still a benefit to consuming plant-based omega-3 fatty acids to reduce cardiovascular disease, comorbid disease, and all-cause mortality in CKD and or end-stage renal disease patients. With this, I would like Shivani to take it over from you. Thank you.
Thank you, Dr. Melinda. So coming to the topic of inflammation. Inflammation in general is a response to tissue injury in which cells of host stiffens, come to the site of injury to eliminate the offending agent. So it can be either acute, whose onset is within minutes to hours, or chronic, which can take days or weeks to establish. So there are a variety of causes leading to inflammation, which range from infection, tissue necrosis, immune reactions, and so on. Next slide, please, ma'am. So coming to the cardinal signs of inflammation, there are 5 signs: redness and heat generation due to vasodilation, pain due to the stimulation of pain receptors or nociceptors, swelling, then finally the loss of function, which may be due to disruption of tissue structure. Next slide, please, ma'am. So an important biomarker in inflammation, like chronic diseases like CKD, is C-reactive protein. CRP is called an acute phase reactant. So in response to any injury or inflammation, there is release of interleukin-6. This interleukin-6 in turn stimulates the liver to synthesize C-reactive protein. So once the inflammation subsides, CRP decreases. So it can be used to monitor the patient's response to treatment as well. Next slide, please, ma'am. So the levels of CRP in blood can change in as little as 24 hours in case of acute inflammation, and it's one of the strongest predictors in case of cardiovascular diseases. This is particularly important because majority of chronic diseases deaths are caused due to CVD. Now, when looking at how diet impacts the levels of CRP, it's shown that foods rich in saturated fat have a positive relationship with CRP levels. They increase the CRP levels. Next slide, please, ma'am. On the other hand, there are also many food and food products that have been shown to decrease inflammation, such as cherries, fiber, whole grains, which lead to a decrease in circulating levels of CRP as well. There's another component, a plant-based protein called soy. It's a complete plant protein that's anti-inflammatory and protects the renal system. Another study also showed that CRP levels were lower in individuals who consumed soy-based protein compared to those who took an animal-based protein during the same period. There's also isoflavone, which is a phytoestrogen. Its serum levels can be measured. So it's derived from soy and it's said to play a role in decreasing the levels of CRP. So these were just a few evidences showing that foods which are anti-inflammatory may be beneficial to CKD patients, but further research is also needed to strengthen this association. Thank you, and over to Srinidhi.
Thank you, Shivani. So now I will be dealing with acidity and alkalinity of foods. Our body has a very fine-tuned mechanism for maintaining the acid-base balance. This is mainly achieved by harmonizing non-carbonic acids like sulfuric acid and phosphoric acid and the bases, which are predominantly the bicarbonates. Now, how does the food we consume contribute to acidity and alkalinity? When we consume protein-rich food, our body metabolizes them, releasing sulfuric acid, and this can lead to acidity if not counteracted. And we have other components for food like fruits and vegetables, which are the major dietary sources of bases, which again, when metabolized, produces organic acids, which then produce bases, predominantly bicarbonates, and these acts as perfect antidotes to the acids produced. Next slide, ma'am. Coming to metabolic acidosis, it arises where the acidity outweighs the body's ability to neutralize it. That is, the high acid levels compared to base production. This condition can arise due to various causes. Firstly, high endogenous production of acid. That is, the body itself is producing too much acid. Secondly, the kidneys are not doing their cleanup jobs effectively. That is, it can be the inefficiency of the kidneys to excrete the acid. And thirdly, it may be due to a deficiency of bicarbonates, which are our internal acid neutralizer. Next slide, ma'am. A typical Western diet characterized by high intake of animal-based foods contributes to a higher acid load in the body. You can imagine a diet rich in meat, cheese, processed foods, etc. All these will gradually tip the balance towards acidity. And on the other side, we have the fruits and vegetables. Increasing the intake of fruits and vegetables has shown promising results in combating metabolic acidosis, especially in individuals with chronic kidney disease. This will neutralize the excess acid, thus restoring the acid-base equilibrium. Next slide, ma'am. So now let's quickly have a look into the findings of a study titled A Comparison of Treating Metabolic Acidosis in CKD Stage 4 Hypertensive Kidney Disease with Fruits and Vegetables or Sodium Bicarbonates. So this study was conducted by Gura et al. And it compared the effects of sodium bicarbonate supplement versus fruits and vegetable supplement over 1 year. Next slide, ma'am. First, talking about the sodium bicarbonate. It had similar effect on acid state as fruits and vegetables, but it also increased the sodium chloride levels. Thus, relying too much on sodium bicarbonate alone might not be sustainable due to increased sodium chloride levels. Whereas fruits and vegetable consumption improved metabolic acidosis, lowered blood pressure with no adverse effects on electrolyte imbalance such as hypernatremia or hyperkalemia. So this study concluded that increasing fruits and vegetable intake seems a better long-term solution and of course a sustainable approach for managing acidity. Next slide, ma'am. So moving on to the measurement of dietary acids, to gauge the acidity of our diet, researchers use a method of calculating scores for different food based on their acid-producing properties. And then these scores are finally summed to determine the overall acid load of the food. So in the previous slide, we talked about calculating scores, right? So this is a score that we calculate, the potential renal acid load score. It is an indicator of dietary acid load, and it also serves the purpose of a guide in when adopting a low acid diet. This is the formula for calculating the PRAL score. The amount of dietary protein, dietary phosphorus, etc. will be calculated by laboratory analysis, or it can be obtained from the nutrient content of that particular food. Next slide, ma'am. So how do we interpret these PRAL scores? Positive PRAL value indicate acid-containing food, whereas a negative PRAL indicate alkaline food. Plant-based food generally have low PRAL score compared to animal-based food. When consumed, they have the potential to decrease the serum creatinine levels, thereby slowing the progression of chronic kidney disease. Also, a low PRAL food improves urine acidity, thereby aiding in the management of CKD. And also in a study by Cosgrove et al., subjects following a low PRAL or vegan diet, a plant-based diet, for just 7 days experienced improved urine pH and reduced dietary cholesterol levels. Next slide, ma'am. So this table, the table in this slide and the following slide depicts common food and the potential renal acid load values. Each score is calculated based on a 100-gram portion. As we've already discussed, positive PRAL value is shown in red color, which indicates acid-containing food, whereas negative PRAL value is shown in green color, and that indicates alkaline food. As we have already discussed, if you could see, fruits and vegetables are shown in green completely. So that means they are alkaline food. Next slide, ma'am. And you can see the animal-based food like meat, dairy, and eggs. It's all shown in red color. That means these are acidic foods, acid-containing foods. So now over to Dr. Sandhya.
Thank you, Srinidhi. So I'm going to now discuss the role of plant-based diet in electrolyte balance in chronic kidney disease patients. So following are the electrolyte imbalances that occur in a chronic kidney disease patient: hyperkalemia, hyperphosphatemia, hypocalcemia, hypernatremia, and hypermagnesemia. Next slide. So because of these electrolyte imbalances, certain clinical manifestations occur in our body. If we take hyperkalemia, the main manifestation is the cardiac arrhythmias, the serious one. And it can also cause muscle weakness, gastric problems like nausea and bloating, and tingling, and certain CNS problems and diminished reflexes. If we take the increased phosphorus levels, hyperphosphatemia in turn lead to hypocalcemia. Because of the increased bone desorption, there will be weakening and brittle bones. There will be decreased calcium, and the vascular calcification will occur because of the increased blood levels of calcium that lead to cardiovascular mortality. Then the hypocalcemia can result in muscle cramps, paresthesias, and the most important and serious side effect, the prolonged QT interval. Then hypernatremia, obviously it will lead to hypertension because of the increased fluid load and increased blood volume. Next slide. So this is a slide which shows the potassium, how the the increased phosphorus level that occurs, because you can see here the kidneys are responsible for 90% of excretion of the potassium. But when there is kidney failure, there will be no filtration of the potassium, and the levels of potassium will be increased in the body. Next slide. So these are the diagrammatic depiction of the clinical manifestations of hyperkalemia. Like there will be erythemias, cardiac arrest, tingling and decreased reflexes, gastrointestinal problems, weakness, paralysis, and hemodynamic instability. Next slide. Yeah, this is a slide which shows the hyperphosphatemia that ultimately resulting in hypocalcemia because of the bone resorption. Next slide. Now coming to the role of plant-based diet in combating this electrolyte imbalance in chronic kidney disease patients. Okay. Here the paradoxical effect of plant-based diet. See, a common concern with increased plant-based diet food intake is the overconsumption or over accumulation of the minerals. These minerals which you have now discussed, the phosphorus, potassium, magnesium, etc. They are contraindicated in CKD patients. But it is a common belief that when you take plant-based diet, it will result in the accumulation of these minerals. Now, how to look at this? What is the paradoxical effect here? These minerals are obviously present in higher abundance in plant foods, but there are findings that have been observed in various studies that there is a less absorption of these minerals. Even though there are higher amounts of these minerals, there is less absorption of these minerals from the plant-based diet than the absorption from the animal sources. That is the important point to note here. The effect of plant-based diet on electrolyte balance in mid-spectrum and the late stages, that is stage 4 and stage 5 chronic kidney disease, the further research needs to be done on that. But the initial stages of the chronic kidney disease, plant-based diet is found to be beneficial in several studies. Now we'll take the individual electrolyte. If we take hyperkalemia, generally when a patient is hyperkalemic, physicians may recommend the restriction of the potassium-rich foods like potatoes, strawberries, bananas, oranges, and spinach. Although there is typically a greater amount of potassium in these plant-based foods, as already said, there tends to be less bioavailability of potassium in these foods as compared to that of animal-based or other heavily processed food products. Next slide. So these are the certain plant-based sources of potassium, bananas, oranges, etc. that you can see in the picture. Additionally, the potassium in the fruits and vegetables is typically ingested with the non-chloride anion, the bicarbonate. The bicarbonate which promotes increased potassium excretion via the urine. And another thing is studies done by Goraya et al. This study has been also discussed by Srinidhi in the previous acidity and alkalinity. So the study done by Goraya et al. And Barsotti et al. Have demonstrated that increasing fruit and vegetable intake does not induce hyperkalemia in CKD patients, which is a common belief. However, the effect in the late stage of CKD is unknown and further research needs to be done on this. Next slide. Yes, now we will take another one, the phosphorus. So what is the effect of animal-based diet on which causes increased phosphorus? We will see that. See, when a person takes non-vegetarian diet like the mutton, chicken, and etc., there will be abundance of this animal protein. And we know that this phosphorus, it binds to animal protein. And from various studies, a strong correlation has been established between the animal protein intake and phosphorus intake, and hence these phosphorus, the abundance of animal protein and the phosphorus binds with it, and there will be more amount of phosphorus that gets accumulated in the body. Next slide. In a study done by Moe et al., it was observed that in CKD patients who are following the plant-based diet, there is a reduction in phosphorus levels. Phosphorus from plant foods, again, this is a paradox. Phosphorus is abundant in plant foods, but it proves to be less bioavailable due to the fact that it primarily binds to phytate, which is poorly absorbed in the gastrointestinal tract because the humans lack the phytase enzyme, which breaks down the phytate. Hence, a plant-based diet could prove beneficial in reducing the phosphorus load on the body and thereby improving the vascular effects and potentially mediating the effects of low calcium levels. Next, on hypernatremia, there is not much research that is done on the effect of plant-based diet on hypernatremia, but generally in CKD patients, it is indicated that we have to take low sodium, that is below 2.3 gram per day, when compared to normal individuals. But there is only one study which you can find, that is study on practical issues for the nutritional management of CKD patients by Alessandro et al. It has been observed that the increased sodium intake is tend to be more when you consume or rely on the animal-based diet exclusively. But further research needs to be done on the effect of plant-based diet on electrolyte imbalance in chronic kidney disease patients. Okay, next, handing over to Josna.
Thank you, Dr. Sandhya. Let us now look into the drawbacks of the plant-based diet. To begin with, let us look into the nutritional deficiency. What are the vitamin and mineral deficiency that come along with plant-based diet? We all know that the animal products are the primary sources of vitamin B12 in the diet. This vitamin is very crucial for various body functions, including the nerve function and the production of DNA, etc. Individuals who follow a plant-based diet typically need to be supplemented with vitamin B12 because these plant-based food are not reliable sources of this vitamin. Also, it has been said that B12 is obtained from unfiltered water or eating unwashed plant food. But modern water purification methods and other agricultural practices have reduced the presence of B12 in these sources. And also, there is a concern that plant-based diet may not provide adequate absorption of certain nutrients like calcium, zinc, and iron. While plant-based sources are nutrient, they may also contain other interfering substances like the phytates and the oxalates, which interfere with the absorption of calcium and zinc. And also, plant sources of iron are non-heme type of iron, which is not as readily absorbable as heme iron, which is produced from animal products. But still more research is needed to carefully assess how these vitamin deficiency and mineral deficiency can be combated in a plant-based diet. Next, moving on to calorie consumption. The current required daily amount of calories is around, for CKD patients especially, is around 30 to 35 kilocalories per kg per day. Many individuals who switch to this plant-based diet have difficulty in consuming adequate number of calories. It is important to include a variety of plant-based products such as starchy vegetables, fruits, and other plant-based products in order to obtain a full calorie requirement. So this is very difficult particularly when you're drawn to one type of food like green leafy vegetables, or just you're going to consume only fruits. This could lead to a deficiency in calories. And also high amount of fiber that is there in this plant-based diet will make the individuals feel full very easily. And this can create a discomfort in the gastrointestinal tract, and further it will stop the individuals from taking the required amount of calories. And finally, let us look into the accessibility issues. In a study by Banerjee, it was found that 4.5% of CKD patients are food insecure, which independently increases their chance of developing end-stage renal disease. With regard to the plant-based diet, there are certain barriers that make this plant-based diet less preferable to normal diet. Firstly, there are social barriers. Example, geographical and cultural differences that we observe in eating patterns. In the US, if you consider, only 5% of the people are proven to be vegetarian, and even fewer, around only 2%, consider themselves to be vegan, and their diets are fully plant-based. Other barriers include availability issues and palatability issues of plant-based food and limited access to food. especially fresh fruits and vegetables, and limited access to unprocessed food. These present a unique challenge to anybody who's trying to adhere to a plant-based diet. And also, when you consider a pure plant-based diet, it requires extra preparation and also more amount of time and skills are required to prepare an accurate or a pure plant-based diet. This also further hinders individuals from adopting this lifestyle. Thank you, and ahead to Dr. Sindhura.
Yeah, thank you so much, Josna. So we have come across till now, my colleagues have mentioned a variety of food groups, plant-based food groups and their compounds, how they can help in ameliorating the chronic kidney disease, where still the further research is still required here. But definitely these presentation gives a basic idea on how the various plant-based food groups can help in improving the complications and the comorbidities associated with chronic kidney disease and also help in reducing the progression as well. So if you look at the current RDAs for CKD patients, it suggests following a diet with low protein in a range of 0.3 to 0.8 gram per kg per day and sodium at less than 2.3 gram per day and phosphate of less than 700 milligram per day. And wherever required, the supplementation of essential amino acids, calcium carbonate, vitamins and iron are required. So the introduction of a diet that is high in fiber, vitamins, and minerals has implications for slowing the progression of chronic kidney disease. And this lifestyle change has the potential to prevent premature death, improve the quality of life, and also it mitigates the associated comorbid diseases, specifically cardiovascular disease, which are considered as the leading cause of mortality in the CKD patients. And through adherence to a whole food plant-based diet or by simply increasing fruit and vegetable intake, chronic kidney disease may be attenuated or prevented if it is identified early. By adapting the habits associated with a whole food plant-based diet, many of the chronic disease outcomes can be reduced, and it's a viable alternative to the current dietary recommendations for the CKD patients. However, further research is still needed to determine the effects that a long-term whole food plant-based diet has on the progression of the CKD and the feasibility of the specific dietary lifestyle change. So again, just a quick recap of how a whole food plant-based diet pyramid looks like and the variety of food groups that can be included based upon the quantity sizes and the servings. And if you look at here are a couple of beautiful whole food plant-based meal plates, which are going to give you approximately, there's a very healthy snack plate inclusion of seeds, peanuts, almonds, lettuce, which is going to give you almost 12 grams of protein with 300 kilocalories. And this is a beautiful cucumber, lettuce, cabbage salad with black bean curry as well as mixed flour roti. So which is almost giving you here around 20 grams of protein and almost 15 grams of fiber in this particular plate. And most importantly, just to stress on the importance of the whole food plant-based diet, the whole food plant-based diet not only helps you in ameliorating the chronic kidney disease and associated complications like reduction of CVD, reduction of blood pressure, reduction of cholesterol levels, and type 2 diabetes, it is also at the same time environmental friendly or eco-friendly, where it can help in reducing the greenhouse gas emissions and the water pollutions as well. So it's going to have a better following a whole food plant-based diet can overall have a better human health impacts as well as the environmental impacts as well. So as we can say, we can start protecting our environment right from our dinner plates. We can protect our health, our own health, as well as the environmental health as well. So this is our choice. If we choose the right kind of a meal plate, we can help in improving the planetary health as well, which is the current need of the hour again. So thank you so much. So this completes today's Journal Club session, Ameliorating Chronic Kidney Disease with a Whole Food Plant-Based Diet. So please do let us know in the chat box how you felt about today's session. Was it insightful? Was it helpful for you? Or if you have any queries, please do drop them in the chat box. We would love to take it. Thank you so much, Dr. Nitish. Very helpful. Could you please share the chart on PRAL of various foods? Definitely, definitely, doctor, we'll be sharing in our WhatsApp group. Yes. How would one plan tailored diet for CKD patient? So that depends upon the condition stage of the CKD where they are, and based on that, what should be their protein intake. Based on that, we can calculate their protein intake, their calorie required caloric intake, and accordingly include whole food plant-based diet, and we can customize it. It was informative. Kindly share the PPT and video link. Sure, doctor, we'll be sharing the video recording link within a couple of days. Very well presented, systematically done. Congratulations. Thank you so much, Dr. Kiran. Very informative. Thank you so much, Dr. Bindu. Thank you so much. It means a lot. Thank you. Thank you so much, Parmeet. Thank you very much. All right. Thank you so much, everyone, for taking out time and attending this session. Hope this was very useful for all of you. We'll be sharing the video recording within a few days, within a couple of days in our WhatsApp group, and we'll be sharing the PRAL chart also in the WhatsApp group. So this is it for today. We'll be coming up with another interesting session in the next month, Journal Club. Please stay tuned. Thank you so much. Have a good night. Bye-bye.